the two main culprits of the causes of ulcer. One is the Helicobacter pylori. Now, Helicobacter pylori is a bacterial infection that actually affects the lining of the stomach. Specifically, people don't really know that they have Helicobacter pylori present in their body system. Okay. They are ignorant about it. Okay. Do you understand? They are ignorant about it, but it is mostly common. It is very common nowadays. Now, once Helicobacter pylori is present in your system, it ulcerates the symptoms of ulcer. Once this bacterium infection is present in your system, it ulcerates ulcer. That is for the H. pylori. That is one of the main cause of ulcer. So now we also talk about the second cause of ulcer. For the second cause of ulcer, it's taking off all these over-the-counter drugs. Now, when we talk about over-the-counter drugs like the...
Welcome to Vital D podcast, in which we bring health tips closer to your nearest doorstep. So today we're talking about a very serious condition that affects a lot of guys and ladies out there. Sometimes people don't pay attention to these symptoms. I can tell you that it is one of those silent killers out there. So today we're talking about ulcer. We're talking about the various what is causing ulcer. We'll start with what is ulcer. We'll now talk about what is causing ulcer. From there, we'll now move back to what is the risk factors associated with ulcer. We're also going to talk about the treatment options as well as lifestyle modifications when it comes to managing ulcer. So we have on our guest today that will be telling us more about this topic. Will tell us more about this condition, so that because we want what we preach here is to bring health is clear to your nearest door. So we have our guest here in the person of pharmacist Blessed Ekong, who will give us an in-depth knowledge on what ulcer it involves in general. So we have him here that will tell us more about what ulcer entails. Welcome to the show, pharmacist Blessed Ekong.
Thank you very much for welcoming me to Vital D. I really do appreciate it. Therefore, what is ulcer? Let's start by giving the definition of ulcer. Ulcer itself, it's called the stomach ulcer, also known as the peptic ulcer. Now, peptic ulcer is an open sore that develops in the lining of the stomach, the small intestine, or also the esophagus. Now, once ulcer occurs, the opening source comes in place. Now, how does the opening source happens? When there is penetration of the lining of the stomach, once there is this penetration of the lining of the stomach acids damages the tissues. This leads to an open sore. Now, there are different types of ulcers. We have the duodenal ulcer, we have the gastric ulcer. Now, duodenal ulcer it's more common than the gastric ulcer itself. Duodenal ulcer, these are sores that develops in the intestines, particularly the small intestine. Now we also have the gastric ulcer. Gastric ulcer, they are sores that occurs in the stomach. That's the lining of the stomach. So that is the type of ulcers. Though we can also talk about the esophageal ulcer. Esophageal ulcer, these are just sores that occurs in the esophagus. Now the esophagus, they are the portions that carries food and also liquid from the throat into the stomach.
Okay, thank you, pharmacist Blessed Echo. You know, while you were saying, you were just saying a lot of grammars ongoing, like esophagus, duodenal, like so. But you know, in layman terms, I also want you to explain so that once most of these people come in contact with this show, they'll be able to understand and then relate to those conditions that they might be first. So I believe we have heard what is ulcer. We just talk about ulceration of the stomach linings as mentioned by pharmacist Blessed Ekong. So without wasting much time, we are going to talk about what could be causing, because you know a lot of people might be having symptoms of ulcer. In fact, some of them, when they are diagnosed that they are having this ulcer, some of them don't seem to believe it. They'll be like how did that happen? I've been eating in the morning, I've been eating in the afternoon, I don't miss my meal. So Blessed, pharmacist Blessed, please, can you give us an insight of what would be causing or what could be giving rise to the development of ulcer?
Thank you very much. Now, when we talk about the causes of ulcer, it ranges, it varies. There are different variations to the causes of ulcer, but let's talk about the two main culprits of the causes of ulcer. One, it's the Helicobacter pylori. Now, Helicobacter pylori is a bacterial infection that actually affects the lining of the stomach. Specifically, people don't really know that they have Helicobacter pylori present in their body system. Okay. They are ignorant about it. Okay. Do you understand? They are ignorant about it, but it is mostly common. It is very common nowadays. Now, once Helicobacter pylori is present in your system, it ulcerates the symptoms of ulcer. Once this bacterium infection is present in your system, it ulcerates ulcer. That is for the H. pylori. That is one of the main cause of ulcer. So now we also talk about the second cause of ulcer. For the second cause of ulcer, it's taking off all these over-the-counter drugs. Now, when we talk about over-the-counter drugs like the NSAIDs, non-steroidal anti-inflammatory drugs, now I can list them, but few of them is the ibuprofen, the aspirin, and also the naproxen sodium. Now, once you take these drugs frequent intake of these drugs ulcerate the stomach, especially for the elderly ones, the older patients. Once they take NSAIDs, because maybe some might take it due to pains or osteoarthritis, frequent intake of this ulcerates the stomach, so it leads to sore in your stomach.
Like you have mentioned NSAID. I think a lot of us are culprit when it comes to NSAID. In fact, I remember a lot of people, maybe because of like the ladies on menstrual cramp, they'll just walk into a community pharmacy or a pattern medicine shop and then buy NSAID. Most of them don't even know how to take it properly. And then to our practitioners out there, a lot of them just prescribe most of this NSAID to the patient, to the clients, without basically counseling or asking them, do you have these symptoms? Have you been diagnosed of ulcer before? Because a lot of NSAID out there, some of them, the quality of it cannot be trusted. Because I can tell you vividly, like most NSAID out there, it's one of the most commonly abused drugs. You just feel pain in your head, you walk into a pattern medicine shop or a community pharmacy, you buy NSAID and then take it. Sometimes there's a lie. Some of them, I believe, I wouldn't say some of them don't know. I would say it's lack of well-informed knowledge close to them, because some of them just feel that taking a particular NSAID could predispose you to ulcer, and then some of them taking it at this other level will not predispose you to ulcer. So Blessed, you have thank you for the insight. At least you have thrown more insight on the dangers of taking NSAID, especially when not prescribed by your prescriber. You have also mentioned that it could also predispose one to ulcer. You also talk about the Helicobacter pylori, that it could also expose one to ulcer. But aside this, I want us to have some insight understanding on the risk factors, because a lot of risk factors could expose you to having ulcer.
Yes.
Aside this main causative agent. So I want you to give us some ideas and then speak more on risk factors that could be linked to development of or occurrence of ulcer.
Yes. Now, in this contemporary world right now, you will see some people coming into a patent pharmacy store, or they will start complaining of pains. Before I go into the risk factors, you will see, just like you said, you will see maybe the practitioner dispensing without counseling the patient, which is not right. It's not right. But some people make a misconception that stress causes ulcer. No, stress, psychological and physiological stress, doesn't really cause ulcer, but it irritates the stomach lining, thereby leading to ulcer itself. Okay. So therefore, physiological stress is one of the risk factors. Okay. We can also name them. We have smoking. Okay.
Yes. Yeah. Very common. That was
very common. Guys, young guys, and other. You can also. Let me not be biased, but you see, smoking. It's also one of the risk factors that leads to ulcer itself. Okay. Then we also have excessive intake of alcohol. Okay. You see, once we take alcohol, you understand, especially on an empty stomach, once you take alcohol itself, it aggravates ulcer. Okay. So therefore, ulcer, it's also among. Then let's also talk about spicy food intake. Okay. All this spicy food, people, they like fries. Okay. So you want to be putting all those fries. You understand? So this also is a risk factor that leads to ulcer itself. Okay.
Thank you so much for taking your time to list some of those risk factors, because I can assure you that a lot of people don't even know that these things are risk factors. Because sometimes when you go to the hospital or community pharmacy settings in which you are being counseled on that maybe you were diagnosed that you have ulcer, you begin to debunk the news that ulcer is something that when we go to the symptoms, the way ulcer manifests, a lot of people may not even believe that they're having ulcer.
It's true.
They'll be feeling that there's something from their village that is running after their lives, because sometimes the symptoms could be very, very uncalled for and unbearable, because sometimes you don't even understand how it's happening. And maybe like sometimes the notion before now was, if you're not eating well, you can come down with ulcer. Yes. But from what you have listed so far, we are not even talking about eating well. Yes, I know, starvation, fasting, it can also predispose one to development of ulcer. Like you mentioned, the NSAID. You also mentioned alcohol.
Yes.
You also mentioned cigarette smoking. I know those are major risk factors, like fasting, in which you have gone for a very long period of time without eating. So that could also that's also another risk factors in which Pharmacist Blessed has informed us today. Because at the end of the day, we want to know what could be exposing one to this ulcer, because the incident of ulcer in a community, in a various communities, is so alarming. Like mostly anywhere you go to, you see people complaining of their self symptoms, of mentioning the various symptoms of ulcer. So thank you, Pharmacist Blessed Ekong, once again for taking your time to explain this to us. So I want us to move about and discuss some symptoms, because these symptoms is what will help us to know the different types of ulcer, like you have mentioned earlier, and then so that we also know, because these symptoms will also help us to know what is really causing it, and then how can we best treat it. So please, can you give us an insight on the various symptoms associated with ulcer?
There are different types, there are symptoms, there are different types of symptoms that occurs. First of all, the major symptom is the burning sensation, the burning pains. We call it the gnawing pains on the stomach. This is one of the first criteria of symptoms you will see on a patient. Once you examine and also you counsel the patient, the first thing you need to ask the patient is, are you feeling pains? Are you having any burning sensation? Now, this is one of the first symptoms in a patient. Now, we also talk about nausea. You feel nauseated. Then we also have vomiting, nausea or vomiting. Then vomiting of blood, or vomiting of blood itself specifically, one of the main symptoms. Once a patient starts vomiting blood, that he or she needs the immediate intervention of a doctor. He or she should run to a doctor, because it is a very severe condition. Now we also talk about dark stools or the tarry stools. Now this arises as a result of internal bleeding. Once a patient has internal bleeding, you will see the patient stooling dark stools. You understand? So these are the major symptoms. Then let's talk about unexplained weight loss.
Yes.
You will see a patient deviating, decreasing very well, predominantly. Then let's also talk about loss of appetite. A patient comes with loss of appetite. He or she doesn't eat too much. You understand? So therefore, this is also one of the symptoms of ulcer.
Pharmacist Blessed, thank you so much once again for taking time to list the various symptoms of ulcer, and I believe our subscribers out there are taking time to get this information, because sometimes the various symptoms you mentioned, you might have one or two that you should not take for granted. We should always link up to your healthcare provider. Like he mentioned the dark stool, unexplained weight loss, the burning sensation, the pains, all those things, vomiting and nausea, even blood, stooling of blood. Those are symptoms of ulcer, as mentioned by Pharmacist Blessed Ekong. So thank you once again. So without wasting much time, I want us to look at the diagnosis of ulcer, because sometimes when most people are just they were like, have you had an issue of ulcer before? They just mention, yes, I have ulcer. You know, a lot of people can have pains.
Yes.
You can have burning sensation, but not because of ulcer. A lot of disease condition out there could also give rise to burning sensation, not necessarily ulcer. You know, most people, when they say, do you have chest pain, burning sensation, they will just say, yes, I do, and they will come down with, give me these drugs for ulcer. But I want us to clarify some things, because the diagnosis of ulcer, sometimes a lot of people don't even know. So I want you to give us some explanation on the various diagnoses of ulcer that one needs to undergo for the person to be attested that the person has an ulcer.
So as an health professional, once a patient walks up to you, and the first thing you need to start examining the patient is to feel the patient's belly, the tummy of the patient, and also ask certain questions like, have you been having pains? Are you feeling tenderness? So these are the two major questions you need to ask the patient. You need to examine the patient from this. So once you do this, then the doctor or the physician can actually use a stethoscope to actually examine whether it will hear sounds. from inside of the stomach. So this is the first thing you need to do. Then the next is the Helicobacter pylori test. That's the H. pylori test. That is presence if there is the presence of bacteria.
A bacteria,
you understand?
Yeah.
In the stomach. So now there are three important criteria when testing for Helicobacter pylori.
Okay.
You understand bacteria. First is the blood test.
Okay.
We have the stool test and also the breath test.
Okay.
These three criteria, they are meant for Helicobacter pylori.
Alright.
Now let's also go down to endoscopy.
Okay.
For endoscopy, once a patient is presented with loss of appetite or weight loss, endoscopy mostly comes in play.
Okay.
Now once how endoscopy works is it's just like a tiny camera inserted into the stomach or the digestive tract.
Okay.
You understand? To actually examine the patient. So this is how endoscopy works. So these three main criteria now they are used for the diagnosis of the patient.
All right, like Pharmacist Blessed has mentioned, he has mentioned Helicobacter pylori test, in which he mentioned the blood, the stool, and then the breath test, and then he also talk about endoscopy as well as X-ray, because these are the major criteria that could be used in the diagnosis of ulcer. So because you can't just say to yourself that you have ulcer when no diagnosis was being done on you. So Pharmacist Blessed, having done all these things, we want to dwell, because as pharmacists we want to talk more on the treatment options, because as men of honor we join hands to ensure that the patient comes out with the best treatment option the patient can get. So I want us to discuss extensively on the treatment options available for our ulcer patients out there. So please, can you give us an insight on the treatment options a patient with ulcer should be encouraged to undergo?
From recent researchers have found out that Helicobacter pylori is present in about 90% of duodenal ulcers and about 60% in stomach ulcers.
Okay.
Do you understand? So this percentage now keeps on declining. So now let's talk about the treatment option. For the treatment option, one is the proton pump inhibitor.
Okay.
The PPIs reduces the acid, it reduces stomach acid, thereby rendering the lining of the stomach, giving it time to heal.
Okay.
Once you use the PPI, once you take PPI, it reduces acid, the stomach acid. Once it reduces this acid, it gives the lining of the stomach to heal.
Okay.
Once this happens, you've achieved the main reason of taking the PPI. So now, but there are different classes. There are different types, the examples of the proton pump.
Okay, so can you give us like up to 3 examples of the proton pump inhibitor? Yes,
we have them. When I was practicing, the most occurring ones when I was practicing FMC, then it's you see the rabeprazole, you see the omeprazole. Most of them they come in caps and also in tabs.
Okay.
Then the injectables. We have the pantoprazole.
Okay.
Then we also have the esomeprazole.
Okay. Yeah.
These are the most common ones you found in the hospital.
Okay. For mentioning this omeprazole, because I want to really have inside understanding of omeprazole, because the best way to take omeprazole, sometimes people don't understand it.
Yes, they don't.
Because like you mentioned earlier, proton pump inhibitor is to inhibit the production of this gastric acid.
Yes.
Now, but a lot of people just sell this product to clients. Everybody wants to make money, but the client welfare should be the priority of that person, because once your client gets 80% money value from the treatment you are giving to the person, that means you have booked a client for life. So I want in the treatment of this taking this PPI, there's always a notion that you should take it 20 minutes before meal or 10 minutes before meal, or take it on empty stomach. What's your view on this misconception that is going around?
As a learned pharmacist, we join hands. So let's tell the public how it's being used. You see the PPI, like the omeprazole, it comes in 20 milligram.
Okay.
Once you take a tablet, it should be 1 tablet 2 times a day. That's morning and also evening.
Okay.
But once you take 1 tablet in the morning, it should be on an empty stomach. That's before meal.
Okay.
That is how you take your omeprazole.
Okay. So that means taking it before meal, that helps ensure that it inhibits the release of those gastric acids
immediately.
So thank you very much for the insight. I believe you're also hearing this from Pharmacist Blessed, because sometimes we just walk into to buy these drugs without really knowing how to get the best out of these medications. These medications are out there to help you get the maximum result concerning the various conditions you are going to, but you have to also take these drugs as prescribed by your prescriber. That's why we always encourage you to always reach out to your prescriber when it comes to taking a particular medication, and then always talk to your pharmacist, because the pharmacist will be the one to counsel you when it comes to drugs, tell you how to take this particular drug, either on empty stomach, take it before meal, 20 to 30 minutes before meal, all those kind of things, because it comes into play for you to get better at the soonest time possible. So like we are on our treatment options. So yes, after having discussed on the protein pump inhibitors, I want us to discuss more on other treatment options available for the management of ulcer.
So we also have the histamine receptor blockers.
Okay.
It's also known as the H2 blockers.
Okay.
So for the H2 blockers, it reduces acid production.
Okay.
That is the main function. It reduces the acid production in the body, in the stomach.
Okay.
So once this happens, there are different types of the histamine receptor blockers.
Okay.
But I think of recent, this histamine receptor blockers is not really used
because of the side effects.
Yeah, it's not really used in practice. Maybe it's really unknown, but it's not really used. You need to meet a physician first before it's prescribed for you.
You know, the side effect might be what might reduce the usage of that product, but it still gives a maximum result when it comes to management of ulcer. So I also feel why most prescribers are not using is because of the side effect. Maybe. Because we also always look at a drug to work. For a drug to work, the benefit should outweigh the risks.
It's true.
You understand? So I feel maybe most prescribers don't want to use because of the side effect. You understand? It's why when it comes to men.
Yes.
You understand? You know, the side effect is basically linked to men.
Yes.
The ladies don't really have problem when it comes to taking that H2 blocker. So okay,
that is why as a patient, before you practice self-medication, you need to walk up to a physician.
Yes.
Before getting such drugs.
Okay.
You understand? So there are examples.
Okay.
Accompanied to histamine receptor.
So, like, can you give us 2 examples?
We have cimetidine.
Okay.
We have ranitidine.
Okay.
Then we have different examples.
Okay. I think cimetidine is the most common one.
Yes,
we see. I think 200 milligrams and 400 milligrams that is out ranitidine. There. That sometimes we take it morning, afternoon, and evening, depending on the severity of your condition. So, so other treatment options available.
We also have the cytoprotective agents.
Okay.
We call them the cytotex. Okay. Example of it is just to protect the lining of the stomach.
Okay.
Example, we can also talk about we have examples like the misoprostol.
Okay.
Misoprostol is
you know that anyway.
you know there's also misconception.
Yes, there's a big misconception about that drug because a lot of people don't know that this product works well when it comes to ulcer patients.
Yes.
Because it offers severe protection to the stomach lining.
Yes.
And that's why for patients that are taking it in line with pains, I think there's a product we call Atrotec.
Yes.
That we have misoprostol and then
mostly Atrotec is given to
for pains where people that have ulcer pains, because that misoprostol will give you a protection over your stomach lining. But you know the misconception that once you see that guy, everybody
it's for a different purpose.
Yes, it's just a misconception. It's a misconception, but that's why it's always good to talk to your healthcare provider, because they'll be at the forefront to give you the information you need in the management of these ulcer. Please go ahead with other treatment options that you have for us, please.
Okay. We also have example of the cytoprotective, the sucralfate.
Okay.
Yes, sucralfate is also there.
Okay.
So there are also basically others.
Okay.
That we can talk about. We have the antacids.
Yes, I think that's one of the most common ones that we have out there.
We have the antacid, which neutralizes the pains, the walls of the stomach, thereby relieving the patient from excessive pain.
So for maximum effect, how do you counsel your patient to take antacid?
No, antacid. Basically, once a patient takes omeprazole 20 to 30 minutes before meal, then you need to give a duration of time, maybe 30 minutes.
Okay.
You understand? After meal, then you take your antacid.
Okay.
10 meals 3 times a day.
You know, a lot of people don't really know this misconception, or I won't call it misconception. You know, some people just combine other drugs and take it with antacid.
No, that's wrong.
Because that's very wrong, because you are killing the efficacy of that product.
You're reducing the potency.
Yes, the potency of that product is gone.
Yes.
So that's why we always encourage clients out there, take your omeprazole, take your antacid 30 minutes to 1 hour after taking a particular any other medication, so that it will allow the potency of that drug to give you the effective potential treatment that you are looking out for. So having mentioned these various treatment options, we talk about the PPI, the protein inhibitor, in which we talked about the omeprazole, rabeprazole, pantoprazole, lansoprazole, esomeprazole. Then we also move further to talk about the H2 blockers, in which you have the cimetidine, ranitidine. We also talk about the stomach protectors, which we mentioned, the misoprostol and the rest. Then we also talk about the antacid, in which we have also mentioned some fewer examples. I think the ulcer gel, a lot of them, Gestic is the most one of the most common ones.
It comes in different
flavor. Different flavor.
Yes.
So these are products that you can use.
Most people, they like Gaviscon.
Yes, that's also another good one, because of that I said simeticon that is inside thereabout. So please always ensure that you talk to your healthcare provider for you to get the best out of these medications. These medications cannot give you maximum result on your own. That's why we are here as pharmacists to tell you that, okay, take this drug at this so time, take this drug so time, because this will give you the best out of this product, because to get the maximum productivity of a particular product, you must take it in line with the instruction as given to you by your prescriber. So always ensure that you take your product as prescribed and recommended by your prescriber. So Pharmacist Blessed, thank you so much once again for taking your time to list out most of these treatment options that we have. I want us to, because in Vital D, what we do is to bring health tips closer to your nearest doorstep, and not just doorsteps. We always emphasize on what can we do at home to remedy these various conditions we talk about, because that's what we preach. And is what can we do at home in the absence of money, drugs? What can we do at home to ensure that if you are having ulcer, or if you are not even an ulcer patient, you can avoid yourself from coming down with the ulcer symptoms. So we are going to talk about the lifestyle modifications when it comes to ulcer, and I want us to dwell more, speak more on it. So I will give you the floor to give us more insight on lifestyle modification, how lifestyle modification can either influence one to having, that is, expose one to having ulcer, or also expose one to not having ulcer.
Thank you very much. Lifestyle modification is one of the key methods of treating ulcer. Okay. Apart from using the synthetic drugs we have. Yeah. Okay. So lifestyle modification is an important criteria. So first thing first, you need to be eating healthy diet. That's the balanced ones. When we talk about it in this economy,
we're talking about healthy diet in this economy. It could be very funny to come.
It's important to take note of healthy diet.
Yeah, I know it's important.
It's very, very important.
It's important.
Healthy diets like the fruits, vegetables like broccoli. It's very, it's necessary. Because it facilitates and heals the source present in the stomach. So that is one of it. Then apart from the healthy diet, healthy living, you need to be hygienic. You need to be hygienic. Researchers has made it known that they don't really know the spread of Helicobacter pylori. Yes, it's not really known.
Wow.
But it may be transmitted from one person to another through body contacts, like kissing. When you're it's actually true. That's from research. That's
why we have to beg them. Let them be very careful after research.
You need to be careful. Yes. You understand? You need to be careful. Don't be carefree. It's important. Then you need to practice washing your hands regularly, especially after using.
But I've noticed that during the spread of the COVID-19, everybody were on their toe when it comes to washing of hands, washing of face, washing of everywhere, wearing gloves, face masks. But after that incident, a lot of people just do some sharpy behaviors out there. Sometimes you go to hospitals, in which you can come down with community acquired pneumonia, for instance, some microbes you can even pick out there. You just come back from hospital, you didn't even get to watch your hand, watch yourself. Maybe your kid, especially some men, your kids just run to you, hug your daddy, and some of them, some of those children are very fragile. Even your wife very, will come out, you are just going back from work, your wife comes to kiss you, you have been in the hospital, they're walking, you are touching a lot of things. So are you, but have you also noticed that after the incidents of COVID-19, a lot of people are not keeping in touch with regular washing of hands?
I think most people, they are not even using the sanitizers again.
No, sanitizers is nobody's using it again, because by then it was gold.
But it's important.
It's very important. So it's very important because it keeps your environment. It sterilizes your hands.
Sterilizes your hands. So you need to keep it.
Okay.
After washing your hands.
So are you encouraging us out there to continue?
Yes, I'm encouraging the public to be using washing hands regularly, and also use of sterilizers.
Okay.
It's important.
Okay.
Then also stop eating unclean food.
Okay.
It's not, no, it's true. This
way you say unclean food, sometimes there's nobody that has money that wants to eat something stupid.
Yes, it's true.
You understand?
Sure.
But the only thing, aside eating stupid food, I also encourage our subscribers and the public, the general public, to always ensure that the food is warm, at least.
Warm?
Yes, should be warmed, yes, at least. Before, yes, at least it will inhibit their activities. Yes, it kills them, a lot of them. But all this cold food that you just maybe, like all this packed roadside food that is open, a lot of flies are standing on it, are jumping from one place to another. It's not warm. You just go there, eat. It could expose you to these dangers.
Yes.
But I encourage our subscribers and then our general public to always ensure that the food they get eating on the roadside should be warmed. And let them. I know they may not have microwave, but let it be something hot at least. You understand? But if it's for eatery, there should be microwave in the eatery that they need to microwave.
If there's no microwave,
you understand? They have no. Don't say that. A lot of eateries might not have it. You understand? Forget the fact that they have it. It might be there as monument. Do you understand? It's not working. So I always encourage people to roadside food, ensure that it's warm. Because we don't go lie. At the end of the day, roadside food sometimes is a lifesaver.
Yes, it's a lifesaver.
It's a lifesaver.
That saved me several. I won't lie.
So you see, it can't come and say that we should not eat again because of the fear of ulcer. No, I encourage us to eat warm food and let them heat it up for you. So at least the temperature will kill most of those microorganisms that cannot survive at certain temperature. Because there are some microbes that can survive at high temperature. Our prayer is that while we are eating that food, that kind of microorganism should not be there.
Yes.
You understand? So that whatever small fire is being heated on the food we are going to eat, and they should be able to kill those small ones that cannot survive that small elevated temperature. So thank you for my blessing, because this sedentary lifestyle we are talking about, I think it's one of the major factors that expose one to ulcer.
Yes,
like drinking of alcohol.
Yes, I've not even said something about
like
excessive intake of alcohol. When I talk about alcohol, I need to smile a lot.
You don't understand. You need to laugh.
So excessive intake of alcohol is one of the lifestyle modification we need to at least reduce.
Okay.
Taking too much of alcohol, especially when you're taking this alcohol on an empty stomach. Now you're taking this alcohol like you're taking it as it's being dispensed. Morning, afternoon, evening, most times at night.
4 times daily.
4 times beyond QID. 4 times daily. Understand. No, we need to really reduce the intake of alcohol.
Okay. Because
it aggravates the symptoms of ulcer immediately.
Okay.
So we need to reduce it.
So when you say alcohol, is it spirit? Or is it beer? Or alcohol in general? Because
now
there are people that cannot stay away from beer, but at least they are not a fan of whiskey.
When we talk about alcohol, immediately you see the volume of alcohol above 20%.
Okay, that's 20, alcohol.
Yes, that's alcohol.
So even some red wine alcohol.
It contains ethanol itself. Okay, so this already.
Okay.
Even though you want to be doing this, you shouldn't be doing it frequently. You need to observe your body system as well.
Even Bible talk about.
Yes, you need to.
So little quantity.
You need to observe. Okay. I'm not stop. Okay. I won't say don't. I won't say don't. But you need to. tamper it.
Yes.
But let me use the word
Another
tamper.
English,
Yes,
tamper.
tamper. You understand?
Okay.
Don't rush it,
Okay.
and don't take it frequently, so that you will not kill your system. Don't kill yourself. We are here to help you.
Okay.
So that is how it's supposed to be. So
Okay.
alcohol must be reduced.
Okay.
So now let's talk about cessation of smoking.
Okay.
You know, even chewing of tobacco,
Mm.
caffeine itself.
Yeah.
So this smoking is one of the key criteria.
You know, as I even know ulcer, that will also expose you to lung cancer.
Yes, it
Yes,
does expose you to cancer
Oh,
itself.
so then before while talking about this smoking, you know, if you go to lounge and some bars out there,
Mm.
a lot of people are taking shisha. So is it different from? Can they expose on to? Can they expose on to ulcer?
You know, when you talk about shisha comes with flavors.
Okay. Okay. Is it the flavor that is deceiving people that is not? It cannot predispose you to having ulcer?
It might happen, but I cannot really tell you. It might happen.
My fear on shisha is not always because of ulcer or anything. My fear is because of what you can easily contact from using that same
Shisha,
pipe.
yes. You know,
Yes,
I actually told you about
You get
body contact.
Yes, because someone that has something like maybe a certain
Hepatitis B.
a species of hepatitis,
Yes.
collect it, finish it up, then pass it on.
It's
Sometimes you can go, you
transmitted
see like 8 people using one pipe in the bar and the lounge. They, as in the spirit of highness, everybody's feeling cruise.
Do you even think some of them brush it? It's important, but you know, people will not really look out for things like that.
Actually,
Because it's called the vibe.
yeah.
You need to vibe to certain situations.
Okay.
So that is how it's supposed to be. So cessation of smoking
Okay.
must be done immediately.
Okay.
So these are the most lifestyle modification and changes you will see out there.
Okay. So that means once our clients out there put this in place, they could reduce the spread of ulcer or the condition of ulcer. All right. Thank you, Pharmacist Blessed Ekong, for taking your time today to tell us more in-depth knowledge on ulcer. We have discussed what is causing ulcer. We talk about the various causes of ulcer, the symptoms of ulcer. We talk about the diagnosis of ulcer. We also talk about treatment options. I want you to talk about lifestyle modifications, like you mentioned, alcohol, smoking, cigarette, cessation, lack of exercise. Those things could also expose one. Stress management. Those could also expose one to having ulcer. Pharmacist Blessed Ekom, thank you once again for coming to the show, Vital Day, to be with us today, and then give us more insight on ulcer and what it could cause. To my audience out there, we have talked about ulcer, in which that basically ulcer is about the ulceration of the stomach lining. We talk about the various symptoms, the causes, and then the predisposing factors. We also talk about how you can manage the occurrence of ulcer symptoms at home. But before we go, I want to talk about milk. You know, a lot of people out there feel that once you drink milk, you are going to stop all ulcer pain. No, ulcer symptoms. That's